Hello and welcome to our online discussion for September 1st, 2017. My name is Amy Hasbrook and I'm joined by Taylor Hyatt. We are from Toujours Vivant, Not Dead Yet. Let's see, TVNDY is a non-religious organization by and for people with disabilities and our allies. Our goal is to inform, unify, and give voice to the disability rights opposition to assisted suicide, euthanasia, and other ending-of-life practices that discriminate against people with disabilities. Today's topics: Council of Canadian Academies MAID expansion study, mental illness, and assisted suicide suggested to mother of disabled woman in Newfoundland. So, our first topic is the Council of Canadian Academies, their medical aid and dying expansion study. This week we're talking about mental illness. This is the second part of our series on the 3 areas of assisted suicide expansion being studied by the Council of Canadian Academies. Today we're discussing mental illness as the main reason for assisted suicide eligibility. And again, as you remember, in the preamble to Bill C-14 on the federal level, they said there were 3 areas to study. One was euthanasia for mature minors, one was mental illness, and the other is via advanced directive. We're going to cover advanced directive next week. First and most obvious problem with allowing assisted suicide and euthanasia for people with psychiatric disabilities is that their wish to die is usually a symptom of the disability, as is the case with depression. The only way to know if the person is receiving the treatment that is best suited to their needs and most effective, and if the person responds to treatment, will be a lessening of their wish to die. So, whereas a physical disability, people might want to die for some reason related to social things, loss of autonomy or physical pain, when it's a psychiatric disability itself that causes the desire to die. So, for example, when my depression gets really bad, that's when I feel like I would rather be dead. And I know that my depression is getting less when those feelings are not so strong. So that's sort of how it works. Do you have anything you want to add, Taylor?
Here.
Okay. The link between mental illness and the wish to die also calls into question a person's ability to make a free and informed choice to end their life. Welcome, Christian.
Sorry, I was slowed down by the unbelievable traffic in Valleyfield.
Okay.
Sorry.
Okay. In a Dutch study of assisted suicides, in 24% of the cases, there was disagreement among the doctors who approved the euthanasia about whether the person was competent and whether all possible treatment options had been tried. So there was disagreement, and yet they went ahead with the euthanasia, which is a little bizarre. But they're supposed to have consulted a mental health professional in all cases where the reason is psychiatric disability. And yet, with the people who were consulted, there was often disagreement in about a quarter of the cases. So that's a little bit bizarre.
And some was killed.
Right. Well, all of them.
All of them, sorry.
Right.
All of them. So
yeah, this is a study of euthanasia.
This is a problem, an obvious problem for.
Yeah. While 74% of people who asked for assisted suicide and euthanasia in one study had depression, many had other conditions that complicated matters, including substance abuse, intellectual disability, or being on the autism spectrum. And schizophrenia is another complicating factor that can.
And all those complicated factors, are very, very difficult to manage for a non-professional in this manner.
Right. Especially, just for a general practitioner who doesn't really understand the interrelationship between psychiatric issues and substance abuse or intellectual disabilities. Trying to trust that to a general practitioner is not a good idea. And also, if the person hasn't been in treatment for a long time with the mental health professional, it's also not a very good assessment. About half of the people also had personality disorders, which increases the chance that their desire for assisted suicide would not be consistent and settled. And that's supposed to be one of the criteria, that it lasts over time. But if you have a personality disorder, you tend to change your mind a lot and have different ideas.
One day you want to be killed, and the next day you are going to have fun with somebody else.
Right, and that's not just people with personality disorders. A lot of people who ask for assisted suicide or euthanasia change their minds.
Myself.
Yeah, but
I had some occasion, some crisis where I was. If somebody had given me a syringe or a gun, I would not be there now. But I greatly appreciate my life now.
Right.
Since a long time.
Right. Right. Did you want to add anything, Taylor?
I was thinking about one of the cases that we're going to discuss next week. Margaret Bentley and her decline with her dementia. She had originally stated that she wanted to die upon reaching a certain point. She got to that point and didn't.
Right. Right, exactly. Margot Bentley, the sound is breaking up a little, so I'll just summarize. Margot Bentley is a person we're going to talk about next week. She originally said she wanted to die if she lost her capacity, but she continued to accept food, obviously changing her mind. And, so in that case, she did change her mind. So,
yeah.
Okay. In addition, the ratio of women to men asking for assisted suicide was over 2 to 1. This lines up with statistics showing that women are most likely to attempt suicide as a cry for help than men, but men are 3 times more likely to complete suicide. Thus, many cries for help from women will result in death in places where assisted suicide and euthanasia are legalized for psychiatric conditions.
So it's discriminatory on both things.
Right, exactly.
Disabled and women.
Right.
Men kill themselves because they use more violent way to kill themselves. So when they try,
Right, exactly. Women attempt suicide a lot, but they don't complete the suicide. There's something that goes wrong, and that's considered a cry for help. And by automatically completing the suicide, assisted suicide denies them that right to cry for help.
Yeah, because if they are asked for an help or die, the physician will kill them 100% of the time.
Right.
There is no more cry for help.
Right. More than a quarter of the people in the Dutch study asked for death from a doctor they didn't already know. Most at a specialized euthanasia clinic. It's hard to imagine that a family doctor or a clinic specializing in euthanasia would be able to correctly decide whether a person's psychiatric disability interfered with their judgment, whether they were getting the best possible treatment, and if they had exhausted all treatment options. And it's very common in Oregon for people to do what's called doctor shopping. They just go from one doctor to another until they find somebody who will do the assisted suicide. And that's also common in Belgium and the Netherlands, that people will
it will become the same here.
Right, and it will become the same if people with psychiatric disabilities.
We have already the Doctor of the Dead, Dr. No in Quebec City, doing a very good job to kill people.
Yeah. That's No as in N-A-U-D, not Dr. No.
Not the same Dr.
Not
No.
the James Bond villain.
Yeah. But he's a villain too.
Yeah. But one thing about, I was going to say something and now it's gone. Oh, well.
Sorry.
Oh, rats. Did you want to add anything, Taylor?
Well, going back to the women for a second, the gender dynamic doesn't stand out. Women have historically. Sorry, I'm cutting out.
Yeah, you're breaking up pretty badly, unfortunately. It's hard to understand.
Yeah, sorry.
What I was going to say is, in treating people with psychiatric disabilities, the relationship between the client and the professional is very, very important. And so if people are hopping from one doctor to another, they're not going to get good treatment. Okay. Another concern is whether legalizing assisted suicide for psychiatric disabilities would lead mental health professionals to believe it is acceptable to give up on treating people with mental disorders. Would that, in turn, cause people with psychiatric disabilities to lose hope about getting treatment or feeling better?
Yeah, when people feel they are use all options possible, even if it's not true, if they believe it, they will try to kill themselves.
Right, exactly. And if the, again, because the treatment is based on a relationship, if the other partner in the relationship, the therapist, is giving up on you, of course you're going to feel discouraged and not like you have any hope.
That's life.
Yeah. Okay. Allowing assisted suicide solely for mental health reasons is a form of legalized discrimination against people with psychiatric disabilities. This discrimination already exists in our society's very different approaches to physical and mental health care. Physical illnesses are considered uncontrollable, whereas mental illness is thought to be a moral failing of the individual. Physical health is therefore seen as a priority, while mental health services have less funding and are unavailable to many who need them. Only 1 in 5 young people who need mental health treatment gets it, and 2/3 of adults who need help don't seek it out either because it's not available or because of the stigma associated with mental illness.
We know it by personal experience.
Right. You know, I've been trying to deal with my depression in addition to being legally blind, and trying to get care is really difficult.
We have difficult to see in regular basis a psychiatrist.
Right.
And even on the spot, we have difficulty to see them.
Right, exactly. Right. If I were actively attempting suicide, I would go to a hospital emergency room, but that wouldn't necessarily guarantee I'd see a mental health professional. So, okay.
It guarantees only that you will be put in jail somewhere.
Yeah, well, not in jail.
Not in jail, but you will be locked up.
Locked up in the hospital.
Yeah.
Right. Mental health treatment has also changed drastically over the past few decades. Instead of interactive therapies, doctors are prescribing drugs. Talk therapy is often not covered. If someone's needs do not respond to pills, the system may claim it is unable to help them. So instead of providing the service the person needs, like some interactive therapy, some relationship to rebuild the person's way of doing relationships and help rebuild their psyche, the system says, well, there's nothing we can do about this, and you're on your own.
And why? Because there's not enough budget.
Right, exactly. Exactly. Is there anything you wanted to add, Taylor?
Nope.
Okay. Reports from the Netherlands and Belgium have shown that many people who are euthanized because of psychiatric disabilities were physically and sexually abused. One example is the case of Anne G., who sought treatment for anorexia. However, rather than being helped, Anne G. was sexually abused by her therapist. After publicly accusing the therapist, who admitted what he had done but was not punished, she was approved for euthanasia by another mental health professional. This death became a second form of victimization.
Yeah, get rid of the abused people,
Right.
and you get rid of the problem.
Right.
That's basically what it said.
Right. And that also applies to people who are not abused by therapists, but who are abused as children. And they grow up and have to deal with major problems because of the abuse. And if the therapist basically gives up on them and saying, you know, you can have assisted suicide because there's nothing we can do for you, that's another form of abandonment and victimization of the person who was abused and who is now ill because of the abuse.
Right. If people close to you are not helpful, and if professionals can't help, what are you going to do?
Yeah, exactly.
I agree with you.
In fact, people with psychiatric disabilities, who are often stigmatized as being dangerous, have the highest rates of abuse, poverty, homelessness, and lack of adequate health care. And I saw one statistic from Harvey Chochinov that said they have an average of 25 years less of life expectancy than people without psychiatric disabilities. So it's really one of the most stigmatized and disadvantaged disability groups, because even, you know, people with physical disabilities, nobody wants to be seen as crazy. And, you know, everybody is still pretty willing to say negative things about people with psychiatric disabilities. There's not so much effort to try not to do that anymore. So it's still very stigmatized. Statistics also show many people asking for euthanasia are socially isolated and lonely. Rather than providing psychosocial supports to these people, the mental health system gives up on them by euthanizing them. And, you know, if people have trouble with relationships, or if depression makes you too tired to try to go out and be with other people, or feel too bad about yourself, have too negative a self-image to want to be with other people, you need help to go out and socialize.
It's obvious.
And if the system that's supposed to help you isn't doing that for you and is saying, yes, you're right, you deserve to die instead, then that's not the right response.
Precisely.
For me, it's obvious. I couldn't dream about somebody who do the other way. But it happened.
Yeah. Research shows that mental health professionals often harbor negative feelings toward suicidal patients. Countertransference describes the therapist's reaction to their patient based on his or her own psychological issues or background. If the therapist is having negative reaction to a suicidal client, this can contribute to a, quote, negative outcome, unquote. In other words, the client's death.
Yeah. Just think about it. The rate of physicians or people who try to help, who are themselves problem, are exactly the same as population, and maybe more. As policemen have more crime than in the average population, because they are right in the subject.
Right. A lot of people go into the psychiatric helping professions because they need help themselves.
Yeah.
And if they are trying to treat somebody who is suicidal
Or depressed,
and the person, you know, the therapist kind of wants some positive feedback too, and if they're not getting any, they can have negative feelings about that. And so if the person you know, is saying essentially, you're not helping me, I want to die, the therapist might say, well,
yeah, it's maybe the solution.
Right, exactly. Rather than realizing that they have an issue with the client and finding another way to help the client.
So there is danger even if you reach the right person.
Right, exactly. Okay. Our next topic is assisted suicide is suggested to mother of disabled woman in Newfoundland. Last November, a 25-year-old woman named Candace Lewis was hospitalized in Newfoundland. Ms. Lewis has cerebral palsy and spina bifida, as well as a seizure disorder.
So heavily handicapped.
Right, she has a profound disabilities.
Yeah.
A doctor suggested to Ms. Lewis' mother, Sheila Elson, that she should be helped to die. When Ms. Elson refused to consent on her daughter's behalf, the doctor called her selfish. Ms. Lewis has since recovered.
Oops.
And we've
a wrong diagnosis.
Right, well, no, we've often talked about how people with disabilities often have complications associated with their disabilities, and that happens. And we're often, you know, at death's door for one reason or another. And as soon as that happens, doctors are always ready to say, you know, pull the plug or assisted suicide. And that's what happened in this case. So she recovered since then. Did you want to say anything, Tyler?
I'm much more interested in the next thing we were going to get to.
Yeah.
When the media coverage got out, Ms. Lewis, the woman who was asked to die, wasn't consulted. Only her mother was.
Right, exactly. Right. And when news outlets were reporting on this a few months ago, only Ms. Elson was quoted, even though Ms. Lewis was the target of the comment and was also upset about the incident. So, as usual, the disabled person was not consulted about what happened to her. So, that's why we have the motto, nothing about us without us, because that's what everybody does. They don't talk to us about what happens to us. They talk to our non-disabled relatives.
Friends.
Did you want to add anything, Taylor?
Just that the assumption of that. I'm having a mental block right now.
It's okay.
The assumption that physical impact means that you need to be treated like a kid is far too common.
Right.
Been there, done that.
Yep. Yes. This incident confirms the fears of many people with disabilities that society, that our voices are unheard and our lives are not valued. The belief that it's better to be dead than disabled inspires many requests for assisted suicide and the whole Death with Dignity movement. So it's that idea that underlies the movement.
Yeah.
It's better to be dead than disabled. And people say, no, it's about people who are already dying. Well, that's not true. It's just not true.
Yeah, a fake news.
Right. They're saying that to justify what they're doing, but it's not really true. People with disabilities already face discrimination in healthcare. As an example, they're often pressured to sign do not resuscitate orders. And we'll talk about that in more detail next week.
It happened to a close friend of mine.
Yeah. Yep. He signed a do not resuscitate order
And died.
and he wasn't resuscitated, even though he had been resuscitated several times
Many
before.
times before with a good quality of life.
Yeah.
But it was not enough.
Yeah. Yeah. Okay. If you want to find out more about our work, you can get more information from our Facebook page at facebook.com/toujours vivant, not dead yet, all one word. visit our website at tvndy.ca. You can email us at info@tv-ndy.ca, or you can follow us on Twitter @TVNDY. Thanks to Taylor for helping out. Thanks to Christian as well.
Thank you, Taylor. Thank you, Amy.
We'll see you all next time.
See you next week.
See you soon.
Bye.
Bye.